Welcome to It's Your Case, presented by VetCT.com. I am Olga Travetti, your radiologist on demand for this week. Today's example is an 8-year-old domestic male entire rabbit with reluctance to move, dragging of the pelvic limbs, and inappetence. We have two views of the chest and abdomen, a right lateral view and a ventrodorsal view. Starting with the lateral view of the abdomen, you may have noticed that the urinary bladder contains uniform mineral material, and also that the bladder extends in the inguinal region with this bilobed appearance. In the inguinal region, there is a large soft tissue opaque mass and when we look more carefully within the soft tissue mass, we can see faint gas opacities as well. In the orthogonal view, we can see the large soft tissue opaque mass superimposed to the right coxal bones. Now, looking at the rest of the abdomen, in the left cranial abdomen, there is homogeneous fat opacity and a mass effect with displacement of the intestinal contents toward the right side and ventrally. Also, in the lateral view, you may have noticed that there is a smoothly marginated, broad-based fat opacity in the subcutaneous mid-abdominal region. Now, going to the chest, it is quite evident that there is an abnormal dorsal deviation of the vertebral column in the lateral view. And when we look at this area in the ventrodorsal view, it is possible to see that there is a deviation of the vertebral column toward the left side. Now, looking at the shape of the vertebrae at the level of the deviation, you may have noticed that the vertebrae become shorter and wedge-shaped with ventral margin that is narrower respect to the dorsal margin. So concluding in this case, we suspect that there is an inguinal hernia with herniation of the urinary bladder and possibly some intestinal loops, possibly the cecum. And we also know that there is mineralized crystalluria. As incidental findings, we have two lipomas, one intra-abdominal lipoma, large, and one small subcutaneous lipoma. And these are incidental findings. And regarding the vertebral column, we have kyphosis, which is dorsal deviation, and scoliosis, which is lateral deviation. And these are most likely secondary to congenital anomaly of the mid-thoracic vertebrae, which have a wedge shape. So be sure to review the full report associated with this case. Thanks a lot for listening, and remember, it's your case, so please post your questions on social media.